Hi everyone, we're back again with another video in our pharmacology series, and we're still on antibiotics. And today we're going to speak about macrolides, right? The class that we're speaking about today is macrolides. So macrolides work by inhibiting and interfering with protein synthesis. They're also bacteriostatic, which means they slow the growth of the infection, and in high doses, they are bactericidal. Macrolides treat a wide range of infections. They're actually considered to be broad spectrum. So some of the infections that they treat are sexually transmitted infections, Lyme disease, and acne. So to identify a macrolide by name, I have two tips here for you. The first one is ACE, A for azithromycin, Z for clarithromycin, and E for erythromycin. But if you would notice something about all of these names, they all end in thromycin, right? Not mycin, thromycin. So that's the way that you can identify macrolides. Macrolides can be given intravenously. They can be given orally by pills or by suspension. What you need to remember about the suspension is that you need to shake it vigorously before you administer the suspension. And they're also available as ointments, as topical ointments and ophthalmic ointments. And with the topical ointments, what we want to do, we want to wash our hands, use gloves, we want to clean the area, and then apply the ointment on the clean area. Macrolides have a few side effects that you should know. They cause GI disturbances, GI effects like nausea, vomiting, diarrhea, and they're very big on GI effects. Because of the GI effects, your client may become non-compliant because the GI effects are so bad. There is also QT prolongation and also hepatotoxicity, and we're going to go into these two side effects in a little while. Okay, but before we do that, if you're getting value from this study session, would you hit the like button, subscribe, and hit the notification bell so you never miss another video from me in this series. So let's go on. So with macrolides, there is that side effect of QT prolongation. So we do not want to give this medication to someone who already has a history of QT prolongation. There are also some antiarrhythmic agents that can also increase the risk of QT prolongation if we give them with macrolides. So we don't want to give macrolides with these agents. There's also a phenomenon called torsades de pointes, and that can also lead to your client having cardiac arrest. So as you can see, QT prolongation can be deadly for your client. So what we're going to do, we're going to monitor our client's ECG. We're going to look at their ECG tracing, and then we're going to let the doctor know. All right. Another side effect is hepatotoxicity, right? And what we want to do, we want to monitor liver enzymes. And the liver enzymes that we're going to monitor AST and ALT values. And what we are looking for is increasing values. And once we see the values are increasing, we're also going to notify the healthcare provider. And now, because we're given macrolides for infections, what's common with infections is that your clients may get a fever. So what medication do we have to be careful with while we're given macrolides? For fever, we have to be mindful about acetaminophen, because remember, acetaminophen also affects our liver. right? So we have to be very careful with acetaminophen, especially if our client is having an increase in their AST and ALT values. Another thing that we want to tell our client is they should not be taking alcohol while they're taking this medication, right? Because it affects the liver. So some other notes I have about macrolides. Macrolides are a penicillin alternative. So if your client is allergic to penicillin, we can give them a macrolide. There are some clients because they've had their valves in their heart replaced. Before they have any kind of dental surgery, they need to take an antibiotic. So if your client is allergic to penicillin, we can give them a macrolide, and this is done for prophylactic use. We should take macrolides on an empty stomach because taking them with food delays absorption. So what we want to do, we want to take them 1 hour before or 2 to 3 hours after a meal. And we should take them with a full glass of water. Macrolides are also given intravenously, but because they can be irritating to blood vessels, we want to give the IV infusion slowly. We want to slowly infuse macrolides. Macrolides crosses the placenta, so we should avoid use in pregnant clients. I'm not saying they're not given to pregnant clients, but we want to avoid them if we can. We also want to assess our patient frequently for a skin rash, because at the first sign of rash, we want to discontinue the therapy because it can be life-threatening. Because the rash we're thinking about Stevens-Johnson syndrome. Macrolides also interact with certain medication. They interact with antacids. Antacids actually decrease the effectiveness of macrolides. When given with warfarin, they increase the risk of bleeding. And when they're given with theophylline, they increase the serum theophylline levels. Another thing that we want to do with macrolides, in addition to assessing our client's skin for the rash, we also want to assess our client's skin and the sclera of their eyes for discoloration, such as yellowing or anything that's jaundice looking, because that may indicate there is something going on with the liver, something going on with our client's liver. Client teaching for macrolides include, we want to teach our client to take the medication at the prescribed intervals. And the intervals are important because we want to maintain a certain amount of the medication in our body, in the client's body at all times. So the intervals help to maintain a therapeutic amount of medication in the client's body, so that way we can control the infection in their body. We want to encourage our client and teach our client to finish the medication completely, even if they're feeling better. Because if they stop the medication prematurely, that may lead to the bacteria becoming resistant to the medication. They may become resistant to the current regimen, and the doctor may have to change the antibiotic to another class. We want to also advise our client to use sunscreen and protective clothing when they go outside, so that we can prevent photosensitivity reactions. Because macrolides are also given to children, it's very important, especially with parents, that we teach them to use the calibrated measuring device that comes with liquid preparations. We don't want them to use something like a household teaspoon or tablespoon to administer the medication. We also want to teach our client to not treat diarrhea at home, especially diarrhea that comes with a fever, because this may be an adverse effect of Clostridium difficile diarrhea. We also want to teach our client that this may occur up to 4 to 6 weeks after they've stopped taking the medication. So we really have to educate our client about this type of diarrhea. We also want to teach our client to not lie down after taking their macrolide medication, because if they lie down or if they take it late at night and go to bed, it can lead to something that's called erosive esophagitis. So we want to prevent this condition in our client. So we're going to teach our client to not lay down or to not take it late at night and go lay down, okay? So if you've gotten value from this study session, guys, subscribe and hit the notification bell so you never miss another video in our series. Thank you for studying with me again. Take care, be well. Bye-bye.